Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Good evening, listeners. Thank you so much for tuning in. You are listening to the Got Pain Avoid Surgery with PRP and Stem Cell Therapy with Dr. Luis Escobar. And we're so happy to have you with us today. And Dr. Luis Escobar, thank you so much for coming.
Thank you for having me again, Norma.
Good. How you been?
Very good, thank you. How have you been?
It's so good to see you again. And listeners out there, we're going to talk about pain. We're going to talk about avoiding surgery. And we're going to talk about this amazing procedure that Dr. Escobar now does in his office that helps people avoid surgery and help regenerate the muscle tissue in their body to help it heal and reduce and or eliminate the pain in your body. So if you'd like to listen in today, you can listen on your AM radio 1470, on your iHeart app at 1470 WNN. And if you want to call in, you can call in at 888-565-1470. And you can also watch us live stream on the AMP2 TV app on through Facebook. So let's just get into it. Dr. Escobar has 3 offices located in Hollywood, in Aventura, and Pembroke Pines. The name of his office is Pain Care Specialist of Florida, and his office is bilingual, and the phone number to contact his office is 954-322-8586. So, Dr. Escobar, what can you tell us this week about injuries? I heard this weekend that the Pittsburgh Steelers were playing the Miami Dolphins, and that the quarterback for the Pittsburgh Steelers, Ben Roethlisberger, injured his knee. Did you hear about that?
I did. Indeed, he re-injured his knee that had already been treated before. I understand that he had some meniscus repair in the past, and he tore it again. He has a partial meniscus tear.
What is a partial meniscus tear? What part of the body is that?
Well, the meniscus is like a cushion in between the 2 major bones on your knee joint.
The knee. Okay.
Correct. Which are the 2 major bones in the knee joint, which are the femur, which is the long bone on the thigh, and the tibia, that is the bone on your lower leg.
Okay.
And the bones have cartilage to make this smooth surface so they don't rub against each other. And in between these 2 bones, there's what is called the meniscus, which is a cushion.
Is that like the cartilage?
It's not cartilage. It's an extra a part of a tissue that is like cushion in between the 2 cartilages and the 2 major bones to soften the impact in between the 2 bones, the cartilage of the 2 bones, so the cartilage will last longer.
Okay. And how does that differentiate from an ACL tear, an anterior cruciate ligament?
Well, ligaments are stabilizing structures in a joint.
Okay.
Whereas the meniscus is like a shock absorber in between the 2 major bones.
Okay. So the ligaments, don't they attach bone to bone?
They do. They do. And you have the anterior cruciate ligament. You have the posterior cruciate ligament, which gives the anterior posterior stability to the knee. And you have the lateral and medial ligaments that give the lateral stability to the knee.
Okay.
So, but all these tendons give stability. The meniscus, on the other hand, gives it like support and decrease impact in between the two major bones, as I mentioned.
And so if I have an injury like this, is it an absolute definite that I have to have surgery?
No, it's not an absolute.
It's not, because I know he went for surgery today. I don't know exactly the extent of his injury, but how can the procedure that you do help if you have an injury that doesn't need surgery?
Well, interestingly enough, the injury that Mr. Roethlisberger,
yes, Big Ben, they call him. Big Ben.
I know Big Ben. I was watching him when he hurt himself yesterday.
Yeah. Well, the Dolphins finally won, right?
Yes. Finally, they won big.
Probably because they knocked them out.
I was amazing. They would have won with or without.
Without Big Ben?
I think so. But anyway, this particular injury that he has is very amenable to treatment with stem cells and PRP treatments. He has what is called a partial meniscus tear, meaning there's the meniscus is damaged, but it's not completely apart.
Yes.
So this injury has a better chance of healing, recovery, and even better chance while doing it with the stem cells. And
so let's talk about the stem cells and the PRP. What does PRP stand for?
Well,
for our listeners out there listening.
PRP stands for platelet-rich plasma.
Okay.
Platelets are cells that are circulating normally in a bloodstream, and these cells have different functions. The most important, the most common function that we think platelets for is the clotting mechanism that the platelets have. I don't know if you have heard patients taking the baby aspirin to avoid a clotting, and that refers to the baby aspirin will keep the platelets from clotting, so to prevent any clotting of arteries, especially in the heart. But platelets have other functions, and one of them is the healing of tissues when these tissues injure themselves. They have, first of all, when an injury that happens, platelets are called to the site of injury, and they work as signaling to tell other cells to come and do whatever they need to do. They release growth factors, cytokines like interleukin, interferon, and all those substances.
All the good stuff in the body.
All the soup to start the healing process.
So basically, there's natural healing that happens when people have their injury. You get a tennis elbow, you get a shoulder sprain, an ankle sprain, but when you end up with injuries that aren't healing very well, and you're starting to look for a solution to the healing, or even to speed up the healing, this is when you can utilize this PRP stem cell therapy?
Absolutely. This treatment with the also I forgot to mention that platelets also call in stem cells into the site of injury.
That happens naturally.
That happens natural, correct. That's part of the normal healing process.
Okay.
When this healing process does not take place good enough or fast enough, as you just mentioned, that's when we can come in and speed up the process. And how we do that is we harvest stem cells and PRP from their own patient, from their own cells, process them, clean them up, then put them precisely at the site of the injury via the injections. These injections are directed either via fluoroscopy or ultrasonography or both, to make sure that we put those cells exactly at the site of the injury to promote the healing process. So it's like having stem cells on steroids, if you will.
Yes, stem cells on steroids, right.
So we bring a lot more of that to the area, and that promotes the healing process.
And how do you harvest the platelet-rich plasma?
Well, there's the platelet-rich plasma is very simple. We just draw some blood from the patient, centrifuge that blood. By centrifuging the blood, we're separating the cells. Some cells we want, some cells we do not want. Red cells, which are the cells that make function of the red cells, the erythrocytes, means function of those is to carry oxygen from here and there. So they're great for the healing process when the healing process is taking place, but not at this particular
So
stage.
you want to separate the red blood cells from the white blood cells
Correct.
from the plasma.
Yes, correct. So we keep the red cells and the white cells apart, and we keep a little bit of the plasma in the platelets.
And the platelets.
Now those platelets are put aside, and then we're re-injecting them into the injury area. If the injury is more severe, well, we keep those platelets, and then we harvest some of the stem cells. Stem cells are in the body, pretty much in every part of the body, every organ in the body, but they're most abundant in the bone marrow of the
Okay.
big bones and on the fat tissue, in the
Okay.
adipose tissue. So we can harvest from any of these two areas, again, process it, separate the cells that we want, and discard the ones that we don't want, and then mix them together with the platelets that we harvested earlier, and then go and inject them at the precise place where the injury is to promote the healing.
Wow, that's absolutely incredible. And
It
now,
is
is that an
incredible.
outpatient, or do I have to be hospitalized to have that treatment done?
This is an outpatient procedure.
In your office?
We do it in the office. It takes approximately 2 hours from the time patient gets to the office, do the harvesting, the processing the cells, and then they re-inject it into the injured area.
That's incredible. And so I just find this fascinating that the body naturally, brings its own stem cells and brings its own platelets when you get injury, but sometimes you need a little boost. So the technology or the medical advancements have now allowed that you can harvest these parts of your bodies and then bring it from one part of your body and inject it into a pain site, and it actually reduces people's pain.
It does. It does. The treatment is aimed, first of all, to treat the symptoms, but most importantly is to regenerate the injury, and then that in and by itself will keep the symptoms from coming back.
So if a doctor is suggesting surgery, it's possible that I may want to think about this before doing surgery?
I would.
You
I
would, yes.
For sure.
I think I would too, based on everything I've been learning and speaking to you over all these weeks, that I think that I would see if I was a candidate. So why don't we go to commercial right now and talk about who would be a candidate when we return. You're listening to the show with Dr. Escobar, Got Pain, Avoid Surgery with Platelet-Rich Plasma and Stem Cell Therapy. His office is located in Aventura, Pembroke Pines, and Hollywood, and his number is 954-322-8586. And if you'd like to call in with any questions, you can reach us at 888-565-1470, and Dr. Escobar would be happy to listen to any of your questions.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialists of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairmen of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
Welcome back, listeners. You're listening to Got Pain, Avoid Surgery with PRP and Stem Cell Regeneration with Dr. Luis Escobar. His offices are located in Aventura, Pembroke Pines, and Hollywood, and his office number is 954-322-8586. Their office is bilingual, and they'd love to talk to you about any pain conditions that you may have, any type of, to find out if you're a candidate, and that's what we're going to get into now, is find out who would be a candidate for PRP stem cell therapy. But first, you can listen to us live on your AM radio in your car. You can listen to us at AMP2 TV Productions on your Facebook and on your iHeart app at 1470 WNN. Thank you so much, Dr. Escobar. So who would be a candidate for stem cell therapy and PRP therapy?
So any patient who wants to, as you mentioned before, to speed up the recovery of any acute injury that has not responded to the normal treatments, including anti-inflammatories and physical therapy, and the injury is lasting a little bit longer than expected, or patient that is an athlete, either a professional or semi-professional, that needs to
they want to get back to their lifestyle.
Heal this injury a lot faster than the normal process would be. That would be a perfect candidate for this type of procedure. Patients with chronic injuries are very good candidates for these procedures, and chronic injuries that haven't healed properly, or chronic injuries that develop into degenerative injuries, such as osteoarthritis.
Yes.
Any injuries to the soft tissues in the joints, or the cartilage in the joints. We mentioned the meniscus, injuries of the spine, intervertebral disc, the facet joints in the spine, and the soft tissues in the spine.
I see.
Patients who have had surgery before and have chronic pain after surgery. Most of the time, you have surgery. The surgery, you look at the x-rays, look perfect, but the patient still has pain.
Yes.
There's some structural issues that need to be addressed. We were mentioning before about the tendons of the knee. Sometimes you have a knee replacement, and the replacement is working well. Everything looks fine. Patient still has a lot of pain. All those tendons, the ACL and PCL are pretty much not there anymore, but the outside tendons of the knee are still there.
Yes.
And they need to be healed properly.
Regenerated.
If they're lax and the knee doesn't have good stability, it's going to cause pain. So all those tendons are amenable to treatment with the stem cells to get stronger and give a better stability to the joint.
Well, you bring up an interesting point. So I'm familiar with osteoarthritis. It's a condition where people at end stage of it, they may need a hip replacement or knee replacement, shoulder replacement. But usually that's sometimes a several year process where I hear people say, well, the doctor, I had started having pain a couple of years ago. Do you think that when you start to get those initial symptoms of osteoarthritis, of pain in that joint, that this could help me avoid surgery?
Absolutely.
Down the road?
As a matter of fact, there will be a perfect patient for
That's a perfect patient
for this mode of treatment. Interestingly, we were talking about the arthritis in the meniscus. There's been studies that have proven that patients who do have early arthritis and they also have a meniscus tear end up having the meniscus repair and still have the pain. And it's believed that some of these symptoms might have not been from the meniscus, but might have been from the arthritis. So why take a chance?
So listeners out there, if you're suffering with that type of pain, don't just sit on it. Don't just force yourself to go through it. Don't keep taking pain pill after pain pill after pain pill. You may be able to get results and get positive results of actually healing and regenerating the tissue around your joint from this type of treatment. And that's why it's so exciting. And that it's not so much a new procedure, it's just new to the lay person to know about it, that having to have surgery, a hip replacement or a knee replacement, is going to take 6, 8 weeks, 12 weeks out of your life to recuperate from that. Isn't that correct, doctor?
It is a major surgery, and as we mentioned, it doesn't happen all of a sudden. This arthritis of the joint is a degenerative process that takes many years to develop.
Yes.
So if we are able to catch this early on and treat it, we may be preventing the surgery from being needed in the first place.
Wouldn't that be wonderful?
That would be wonderful, absolutely.
And what I heard you say also, and actually I'd never even thought of this question before, is that if you have had a knee replacement or a hip replacement, any type of hardware placed in your body, even in your back, people have laminectomies, cervical or lumbar. Are you saying that it's not a contraindication? It's not against? Would you still be a candidate if you have that hardware in your body to get PRP and stem cell therapy?
It is definitely not a contraindication.
It's
As a matter
not.
of fact,
Well, that's very good news.
Having pain after any of these procedures is a very good indication to have these treatments, because the surgery, the surgical part of the process is already fixed. Let's say you mentioned the hardware in the spine, in the neck, or in the lumbar spine. Whatever was unstable has been stabilized by the hardware, but
Okay.
the soft tissues may not be stable enough, may not be strong enough to sustain the other parts of the spine, and may be what's giving the pain. Sometimes the nerves are trapped and have developed some scar tissue.
Scar tissue.
These stem cells and the PRP may be very useful in treating that scar tissue and treating the irritation of the nerve that is entrapped in that scar tissue. So it's never too late to treat any patient that has had or has not had surgery with this mode of treatment.
Well, that's good news. That's
This is
good
what we're
news.
trying to enhance the natural healing prowess of our bodies.
Yes.
There's nothing more perfect in this world than the human body. And the human body knows how to heal itself. Sometimes it's not enough. And we can bring those same stem cells that the
Yes.
human body uses to heal itself, give more of those, and I'm talking millions more, to the area where the injury is, and then that will help dramatically the healing and the regeneration of the injured area.
Well, the name of your office is called Pain Care Specialists of Florida, and like we said before, he has 3 locations located in Aventura, Pembroke Pines, and Hollywood. His office number is 954-322-8586. Now, Dr. Escobar, in your office, do you see a lot of back injuries?
We do.
You do? And so what are common back injuries that people come into your office?
Well, the most common injury is an acute injury will be a herniated disc.
You know, last week you mentioned a lot of people after the hurricane came in with a lot of injuries.
Mm-hmm.
And so I imagine they don't come in and you go, boom, you need stem cells, or do you? I don't know.
Well, no, you do not. Just to give you an idea, the most common reason for doctor visits in the United States is pain of some sort. Back pain is amongst the most common.
It's one of the most common.
But interestingly enough, is that 90% of the majority of back pain issues resolve spontaneously or with minor interventions such as anti-inflammatories and therapy in a matter of weeks.
Sure.
The other 10% that does not resolve becomes problematic, and this may be representative of a higher injury such as a herniated disc or a fracture or some soft tissue abnormality on the spine.
Are you able to take x-rays in your office?
We do not do diagnostic x-rays, but we do, our procedures are under direct fluoroscopy. So for that, we do use x-rays.
So you could actually see a fracture underneath that? Or would you send them out for an x-ray?
We will, if necessary, we will send them out for x-rays.
It's common procedure.
Or MRIs.
Okay.
Depending on what the stage of the injury is. Early on in the injury, you start with the basics, perhaps do some x-rays. If this is a chronic injury already, you need something more invasive, such as an MRI. In MRI, we can see the soft tissues as well as the hard tissues, such as bone, and it's a better diagnostic tool than just an x-ray.
And is herniated disc different than sciatica?
Well, there's 2 different entities. Herniated disc will give you sciatica, but
Okay.
sciatica is a symptom. That's a irritation of the nerve. The sciatic nerve is the most commonly nerve that is affected by a herniated disc. Anatomically, your lower disc, the L5S1, because of the anatomy is the one that injures the most, and then irritating the sciatic nerve. In there, where the term sciatica comes into play.
So if I have a herniated disc, more like L5S1, I may end up with the sciatica. But you can have a higher herniated disc higher up.
Correct.
And not necessarily have sciatica.
Correct.
Yes.
You will have, the proper term is radiculopathy.
That's what I was going to say.
So,
radiculopathy.
Correct.
Radiculopathy.
And depending which nerve is affected, if it's the most common, which is the sciatic nerve, then people call it sciatica. So it's a street term, if you will, not necessarily a medical term. The proper term will be radiculopathy, and it will be depending which level the injury is, your sciatica, if you will be located in different areas. So the radiculopathy of the sciatic nerve is in the posterior back of the posterior leg. If you have like an L5, it would be a little lateral. If it would be L3 or 4, it would be more anterior in the leg. So it's different location of the pain, but the same mechanism of action.
That's it's fascinating. I know that a lot of people, they go to their doctor and they get their MRI reports and they read them and they have all these fancy words like radiculopathy and herniated disc or spondylolisthesis and these types of words that we need kind of help from the doctor to help explain what these mean and also how to figure out how to help it. So I know you have background in anesthesiology. That's your original, how would I say it?
My primary specialty.
Your primary
yes.
specialty. And how does that assist you in your skills in order to treat your patients?
Well, anesthesiology is the mother of pain management, as a specialty.
Because you put people out, so then they don't feel any pain?
Well, there's two parts to anesthesia. You have the general anesthesia, where you put people out.
Okay.
And there is regional anesthesia, where you actually do injections to block nerves and
like an epidural?
Like epidural will be one injection, but we also do injections and specifically to the particular nerves, like the sciatic nerve, for instance. Or
is that like a facet injection?
No, that would be a direct nerve block.
A direct nerve
yes.
block. Okay.
And then from then, anesthesia evolved to a more intensive interventional pain management, where we knew that we can get to different areas and deliver medication to control symptoms, mostly for surgery, to numb areas to have surgery. And then we started using those skills into controlling chronic pain. And then this evolved into this new area, which is the stem cells.
The stem cells.
And platelet-rich plasma, because we already have the skill of putting the medication at the right place.
Well, Dr. Escobar, we could keep talking on and on and on about these things, and I know that our listeners out there are familiar with hearing the term epidurals and cortisone shots and those things, and if you've gone those routes and you're saying, what am I going to do? How am I going to help myself? Then PRP therapy and stem cell therapy may be what you may want to consider. So Dr. Escobar would be happy to hear from you. His office number is 954-322-8586. The name of his office is Pain Care Specialist of Florida. He can be found on his website at www.painconsults.com. Thank you so much for listening to Got Pain, Avoid Surgery with PRP and Stem Cell Regeneration with Dr. Luis Escobar. And we'll see you next week, everyone. Have a great week.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.